am Shuan, and my son is Eve. Eve and his twin brother were born prematurely due to the rare twins-to-twins transfusion syndrome. They stayed in ICU for a few months before discharging. The doctors told her that the ultrasound scan showed that Eve's brain was seriously affected and unlikely he will be able to walk or take care of himself because of the severe cerebral palsy condition. It was a shock to us and perhaps the saddest and the darkest day in my life.
My name is Mas. My daughter is Elena Isabella. I'm the main caregiver. My girl has cerebral palsy and GDD. When she was 3 days old, she was admitted to Mount Alvernia. Her heartbeat stopped, and doctor managed to resuscitate her. We were told that she has MRSA. When I first learned about her diagnosis, I was shocked, worried, sad, and of course lost for words. However, what kept me going was that every time she learned something new and she able to do something, you gave me the strength to push forward even more.
Hi, my name is Yvette and my son is Elijah. He has autism and speech delay. Currently, he's studying at Rainbow Center. Quitting my job was the best decision I had made, and it allows me the flexibility of spending time to understand Elijah and assist him.
Our support system started the moment we knew about her late twin sister's brain tumor condition in the womb at 3 months pregnancy, which also will affect her and my life. It was fatal. From the day she was born at 800 grams in the incubator, going through life support, and especially after her 2 major heart and stoma operations, we made sure to see her as a family whenever we can in the night, instead until she's discharged. Since I was not well and my husband need to work, Jeffer and Haley were the ones who took charge, not just taking great care of her, but also the other 3 smaller siblings.
Especially since our mother was not well for quite a while. We took turns sending her to and from school daily and to her therapy sessions weekly. We also taught and guided her with her school and therapy homework. I always made a point to be ready to send Cassie for her therapy sessions at the hospital whenever I had to, even though I had national service.
We are determined to let Eve live an active life, so we help him to exercise. Before he is 8 years old, almost every alternate year, we brought him back to China for 3 months intensive therapy treatment. When we are in Singapore, we also make sure he exercises on a daily basis to keep his joint healthy and to reduce his muscle tone. Persistency, opening to doctor and therapist advice, paying attention to each response, and enjoy each moment of progress are the key for us to be able to continue this on a daily basis.
I'm always trying to find ways to help my daughter. Sometimes I saw an article or happen to see something online that benefits my girl. I will Google to find out more info and ask some teachers or even therapists or doctors for more details to ensure that the therapy or methods are best for her. I saw she followed the educational video hand gesture. I personally learned the hand gesture through the video and taught her. I also took out sign language class for her so that I can teach her the right hand gesture. And through sign language, it helped me to better teach her new concept or skill.
My love for my child motivates me in wanting to understand more about special needs, and I do so by attending courses and talks. This allows me to have more knowledge in understanding children with special needs. It allows me to see things from the child's perspective, and it provides me with more knowledge and ideas in handling my child. Elijah has dyspraxia, hence poor hand-eye coordination. So when attending sports program with him, it gives me a chance to learn from others new ideas that I can teach him to assist him in his overall well-being. Elijah likes greenery, so by teaching him gardening, he can learn the life cycle of the various plants and harvest his own crops. The responsibility of maintaining the garden at our place is under him. Elijah is a sensory seeker and likes to play with paint and drawing, but is unable to visualize the picture, hence I will have to teach him how to draw by breaking down into various parts which make it attainable for him.
We try to involve each sibling in taking care of Eve. His twin brother and younger sister will help prepare his feeding utensils or showering chair, clothes, and pushing his stroller around in parks. We train them to learn how to feed Eve water and simple food, to pet him to make him sleep.
Our family core values are love plus care, honest with respect, adaptability, unity, and quality family time. Strong love creates strong bonds between us, which then comes care for each other naturally. So we always remind ourselves that we are a family and we need each other.
There was a time a few years ago, Eve's muscle tone cycle becomes a bit unmanageable. He will arch back the whole night, perspire a lot, and wetting clothes every half an hour, even he's in the aircon room. It was really a hard time to take care of him when he had those episodes. During the hardest times, it was the adorable smile that Eve gave to us when he was not suffering that motivated me to continue. There was time when I was very tired and almost burnt out. The support from my family members, my friends, including other parents of kids with special needs, and the love for Eve is what made me carry on.
There are bound to be people who will comment or give dirty look, but being a special need is not our child's choice, and getting upset will not improve the situation. Elijah once shared with the therapist and me that he's grateful that he's able to walk, and some of his schoolmates are unable to do so. This simple thought has kept me thinking that we should be grateful for what we are blessed with, and there are many people who are less fortunate than us. Parenting a special need is difficult, but it's not impossible, and this helps me become a stronger person.
Club Rainbow has a lot of events that benefit her, such as the dancing class, the art class, the therapy session, and of course, the holiday programs. I participate her in most programs so that she can learn different things. Through this program, I met other caregivers, and we bonded, we exchanged numbers. Till this day, we keep in touch, we update each other, and we went out together.
Club Rainbow has provided Elijah with so many opportunities to attain various courses ranging from baking to art. He has even managed to obtain the WSQ with the help from Club Rainbow. We are really grateful that we are able to experience all these courses which many of the special needs are not given the opportunity to be exposed to. Elijah has even tried volunteering by giving out lunch to old folks and cleaning up the beaches. Just as Elijah is learning, I'm learning to let go and letting him be more independent. Currently, he's learning to do simple household chores. My hope for Elijah is to be happy and healthy and never give up, as Mommy and Daddy will always be his pillar if he falls.
It was definitely a very hard journey for anyone who needs to take care of kids with special needs, full with uncertainty and also requiring us to continuously adjust our expectation and our approach. It is rewarding when you see your efforts make a difference to the life of your kid.
Never ever give up hope, because miracles always happen. Never ever once doubt yourself, trust yourself and trust your special needs kids. They can do it. Make the impossible possible.
Yes, it is certainly challenging to raise a special child, but with all hands on deck, the task will be easier and bearable.
My message to all other families who have children with special needs will be that all children can learn if they are given the opportunity, patience, love, and support. It's not impossible. Just give them some time and things will turn better. Smile and the whole world will smile with you.